founding member of National Nurses United, and as the past chair of its legislative council, I'm particularly honored and pleased that I was asked to introduce our keynote speaker today. Heidi Hoechst is the Assistant Director of the National Nurses United's Social Justice and Equity Division. And previously, she was the lead of the union's University Certificate Program in Global Women's Health Leadership and taught continuing education classes on health systems, social determinants of health, and the transformative power of militant working class movements. So I'm very pleased to introduce Heidi to set the tone for today's militant meeting. Thanks, Heidi. Go right ahead.
Thank you so much, Sandy. And thank you all for inviting National Nurses United to be part of this timely and important conversation. I have so much appreciation for the Planning Committee's foresight in asking us to envision a holistic and integrated approach to healthcare justice today. So many of you, I'm sure, are familiar with National Nurses United's longstanding campaign for Medicare for All, which is a movement led from the frontline compassion of bedside nurses. Nurses who are relentlessly committed to wresting control of healthcare resources and access away from the clutches of capital. There's no doubt about it, transforming healthcare financing is fundamentally necessary to advance healthcare justice in this country. But as the call for this conference reminds us, we also need an equally strong commitment to preventing social harm and improving real-world conditions of injustice and inequity that undergird our nation's faltering public health infrastructure. As a social justice union, NNU believes that our intersecting fights for racial, gender, economic, healthcare, environmental, and global justice are all the building blocks for a more equitable, sustainable, and beautiful world. And we believe that union nurses, alongside social movements, have an essential role to play in collective struggles for building a healthy and just society. Our union represents healthcare workers, registered nurses, who are primarily women in a $4 trillion industry, healthcare, an industry that relies heavily on a racialized and gendered workforce. The healthcare sector is one of the fastest growing job sectors in the country, and the industry is committed to a winner-take-all goal of turning human need into egregious profits. The majority of big hospital employers in the United States engage in business practices that profit from racism and deepen racial inequities, which has been heightened due to cost cutting during the pandemic. Yet, even as the day-to-day business dealings of the healthcare industry has worsened structural racism in many ways, most big hospital corporations in this past year have attempted to rebrand themselves as proponents of social and racial justice. But even during a pandemic, while Black, Brown, and Indigenous people are dying at rates 3 to 5 times higher than white people, major hospital chains are moving forward with plans to close hospitals in poor communities of color because simply they're less profitable. A record 19 rural hospitals in poor and communities of color were closed in 2020. Communities where hospitals have been shuttered have an average of 37% higher COVID-19 mortality rates. More than 100 US hospitals have closed over the past decade, and industry insiders project an exponential increase in closures in the decade to come. Some think that we could lose as many as 1,000 more hospitals in the next 10 years, which is about 25% of US hospitals. The same employers that are closing hospitals aim to replace direct care with much more profitable telehealth and do-it-yourself alternatives. They claim that technology will help reduce health disparities by making it easier for patients of color to access care, even as these same companies are taking no steps to address structural conditions that make telehealth incredibly inaccessible and inequitable for communities that are increasingly being left with no other choice. They're saying, let's have telehealth without addressing the issues of lack of broadband access, technological literacy, and patient trust. The major upswing in the industry's promotion of telehealth as a permanent solution, rather than as a temporary stopgap during this pandemic, is about shifting care to less costly outpatient settings, avoiding regulations, avoiding unions, and preying on an underpaid workforce of home care workers who are overwhelmingly women of color. In sum, it is about further entrenching our country into a profit-based healthcare system at the expense of public health and at the cost of investing in actually effective public health infrastructure. The abandonment of public health and unchecked monopoly of corporate healthcare giants sets up a severely imbalanced two-tiered system in which communities with the highest health needs are increasingly left with no resources and extremely limited access to skilled professional, direct, hands-on care. The COVID-19 pandemic has not only intensified and exposed deep-seated economic, racial, and gendered inequities in our social and economic systems, it has also clearly exposed the fragility of our social and health infrastructure, while also highlighting how very essential direct hands-on care is for both economic and social health. So as Sandy mentioned, I head our union's recently launched Social Justice and Equity Division. This division was founded with the intention of developing nurses' capacity and strategic impact in transforming systems, institutions, policies, and practices that perpetuate social, health, and workplace injustice. From addressing oppression in the workplace to undoing structural inequality in the broader society, we are deeply committed to building a healthy and just world for all people. And that includes ensuring that when we win our fights for Medicare for all people will have access to the social resources they need in order to be healthy and safe. And this includes healthcare services, but also food, housing, safe places, and rebuilding a just public health infrastructure. Given that we're living through an economic crisis rooted in a public health emergency, we need to envision Medicare for All not only as an increasingly necessary measure for solving many of our immediate health emergencies by guaranteeing healthcare to anyone who needs it, but we also need to think about and relate to Medicare for All as a potentially transformative, non-reformist reform that sets a profound precedent for shifting the values of our nation's economy away from violent, masculine investments in war, competition, aggression, and indifference, and paves the way for a new care-based economy. Actual care, not commodified care. By care-based economy, I am referring to an economy that cares for people and for the planet, an economy that invests in all that we do to sustain life and repair our world so that all people can live as well as possible. As you all know, budgets are political tools. They reflect a nation's priorities, orientation, and values. The US healthcare industry comprises 1/6 of our national economy. Medicare for All, in effect, divests from an economy that prioritizes profits over people and creates an economic imperative to protect people as the essential purpose of society. By laying the foundations for a caring economy in 1/6 of the national economy, Medicare for All could serve as a much needed precedent and a stepping stone for rebuilding our entire economy to value all people as essential. Nurses have learned a lot during the pandemic about our nation's need for a radical revolution of values, a shift from what Dr. Martin Luther King understood as a thing-oriented society, ruled by the triplets of racism, materialism, and militarism, toward a person-oriented society. In the United States, our market-driven system of private insurance creates tremendous barriers and leads to tens of thousands of unnecessary deaths every year. This past year, dealing with the outright negligence and lack of preparedness of the US healthcare system has been one of the most challenging and heartbreaking years of nurses' lives. It's difficult enough to deal with a pandemic, but nurses and other frontline workers have been fighting for their lives while witnessing the unnecessary deaths of hundreds and thousands of patients, losing over 3,875 healthcare workers and mourning the deaths of 405 of their registered nurse colleagues. Nurses have been fighting for over a year and a half, tooth and nail, for patients and communities against an industry that continues to restrict their access to necessary protective gear, an industry that has attempted to use this pandemic to crush hard-won safe staffing ratios, an industry that decimates the capacity of our public health systems by abandoning the highest cost and highest need patients. Reckless employer cost-cutting, devaluation of care work, and systemic racism have disproportionately harmed healthcare workers of color. Nurses of color report having inadequate personal protective equipment or having to reuse their PPE at 1.5 times the rates of white nurses. During the coronavirus pandemic, 54.1% of the nurses who have died in the United States have been nurses of color, even though people of color make up just 24.1% of the profession. Our union's social justice vision is a big picture vision, but it also is a vision that takes into account the serious issues nurses and other healthcare workers have day to day in hospitals. Health workers witness social injustice every day. They see how racism, poverty, gender discrimination, and criminalization affects their patients. They see how it dispossesses them, dehumanizes them, makes them sick, and denies them care. Nurses see how people of color are more likely to die from preventable diseases. They see immigrant patients disregarded because of their document status or the languages they speak. They see transgender and gender nonconforming patients denied basic dignity and respect. They see the social ills of poverty and police violence spill into healthcare facilities. They see how our failure to follow the precautionary principle and uphold safe staffing rules has hit patients of color harder, has hit poor patients harder. Nurses see Black patients sent home early and not come back when symptoms worsen because of the high cost of emergency room visits. And nurses see that Medicare for All and global unity point us toward another way, that other way being solidarity, science, and public health. Nursing is a global profession. The struggles of nurses as frontline workers, as caregivers, as trade unionists are global struggles. Solidarity across borders is not only a value, but in these times, a requirement in our struggle to build power for workers and for our communities. We must continue to push for an end to global healthcare apartheid, where resources and profits are squandered by the global north at the expense of workers and peoples on the rest of the planet. We must push wealthy nations to contribute their vast resources to health and well-being of all peoples, and to divest from militarism and end sanctions that cause harm and needlessly deny healthcare resources for millions of people in urgent need. Nurses are committed to the fight for Medicare for All because they believe that this country is capable of building the compassionate moral and political will that will make us all free, that will make free, accessible, and sustainable healthcare for all people a fundamental human right. Nurses have learned from their colleagues around the world that if a country makes it a priority to care for its people, it can and it will. And that we can come together collectively to make the decision that care for one another is more important than profiting off of the suffering of many. We can make transformation happen. The deep-seated structural inequities that this pandemic has laid bare in US hospitals, in our communities, and across the world demand collective effort, creativity, and new social and economic formations at a scale that surpasses anything we've experienced in our lifetimes. The long and beautiful struggle for justice continues, and the movement for healthcare justice will be central in shaping what comes next for us as a society and as a global community that is committed to the health and well-being of all people. Even as the road ahead remains unclear and at times very uncertain, the many struggles and persistence that we've been through during this pandemic are cause for cautious optimism. Every day, we are reminded that when we live by our social justice principles and act from a deeply rooted sense of community and activism, we build deeper power and we win greater successes. The capitalist forces that we are up against are way too comfortable with death. The unrelenting and safe activism that has held us together during this pandemic, activism for workplace safety, activism for healthcare justice, and for racial justice, this activism is a testimony of our love for patients and communities. There's no question that we need a radical reorientation of society and the economy. Our joint struggles for healthcare justice contribute to new foundations for realizing a deeper, more lasting, more just, multiracial, feminist working people's democracy. This is what true revolutions are about. They're about redefining our relationships with one another, to the planet, and to the world, about creating new ways of being in the places and spaces left vacant by the destruction of the old. Our resistance is about hope. It is not about despair. It's about saying yes to life and no to the sexism, racism, class violence, and organized abandonment that has brought us to this egregious period of extreme inequity in our society. Dr. Martin Luther King Jr. once described love as the readiness to go to any length to restore community. This is what it means to be a social justice union. This is what it means to fight for healthcare justice. Nurses and other frontline workers have come into their own during this pandemic, claiming a rightful place for care at the center of the economy and opening new horizons for understanding militant love, democracy, and justice as the path forward. Our fights for healthcare justice are broad and they are deep. Healthcare justice is about access to care, but it's also about improving social determinants of health with access to education, safe communities, housing, and food. It's about coupling science with solidarity so that treatments and vaccines are universally available. It's about working together across our sectors and specializations to fight for a holistic approach to health and social well-being. It's about rallying our communities and leading working people to expand and deepen how we think about our relationships to labor, land, and other peoples, other countries, and ourselves. And it's about honoring our sisters and brothers and siblings by doubling our resolve and commitment as working people to fight for justice and a healthy world, to fight for universal health care, to forge a society and a global community built on real care and solidarity. And we are so excited to be in this fight with you all. Thank you so much for your time today.